Okay, so first of all, I uploaded the risk factors on the drive, so I won't go over them. خلاص يعني كل شيء واضح. And I'll try to, talk in general. I won't go into the FYIs. So first, the main goals for gout treatment. They're written here just so you can remember them. They're to relieve symptoms of acute gout attack, to achieve serum urate levels of less than 6 milligrams per deciliter. That's because it's slightly below the solubility point of urate, which is this over here. And also we want to prevent recurrent gout. And lastly, we want to prevent chronic joint dysfunction and other organ complications, such as nephropathy. Okay, so now that we got that out of the way, we'll start by classifications. So as you can see, these three that are in suits, the suits here represent that these drugs are for chronic gout. So suits mean this is for chronic gout. And the two over here that are on the table, this is for acute gout. So if we want to see the drugs that are for the chronic gout, they are called hypouricemic drugs because they treat, they treat hyperuricemia, and they're classified into three. So you can either inhibit the synthesis of uric acid, you can either increase the excretion of uric acid, or you can increase the metabolism of uric acid. So decrease synthesis, increase excretion, increase metabolism. And these two over here, allopurinol and probenecid, these are uricostatic. Because they're uricostatic, I put them over here, so they are basically the guards of entry for this party or whatever is going on. So if we start with allopurinol, so allopurinol, purine, it's a purine analog. And you can see the P over here. So allopurinol, as well as, over here you can see pegloticase, they're both used as prophylaxis. Prophylaxis for what? To prevent hyperuricemia. As I was saying, so the P's over here for both allopurinol and pegloticase, they're used as prophylaxis to prevent hyperuricemia. And in this picture you can see over here, they prevent hyperuricemia, specifically in patients with, if you can see these two balloons over here. So these balloons represent patients with leukemia. And over here you can see I'll be honest. And here they're not only patients with leukemia, also patients who are receiving anti-cancer treatment. So as we just said, that allopurinol, pegloticase, they're both used as prophylaxis for patients with leukemia and who are receiving anti-cancer treatment. Hence, they're balloons. Okay. Also, you can see over here, Allopurinol has the bioavailability of 0.8. This means that it is readily absorbed. Okay, it's readily absorbed. How is it readily absorbed? Readily absorbed, again here, the mouth, orally. Like, or you can also say, like allopurinol, okay, you open your mouth, so orally, just to remember it. Okay. So allopurinol can be metabolized into oxypurinol. It can be metabolized into oxypurinol, and oxypurinol is very active. And we don't want that. Okay. So here the drama that's going on over here. Just so you remember. So there's going to be inhibition going on. So here is oxypurinol. So oxypurinol is a non-competitive inhibitor of the xanthine oxidase enzyme. So here you can see that it's non-competitive. Look at how like dejected Oxy looks. So definitely not a competition to allopurinol. Non-competitive. Whereas here, it is a competitive. Whereas allopurinol is a competitive inhibitor of xanthine oxidase. So oxypurinol is non-competitive, whereas allopurinol is competitive. Okay. Something else here is over here. نفس الشيء قلت لكم ربط يوسف الملا. So this car is 6-mercaptopurine, so 6-MP, which is the anti-cancer. So allopurinol is competing with 6-MP for the enzyme XO. So you can say that they both are bodyguards and they both were competing for this job. So they were competing for the job. And since 6-MP didn't get it, she got angry. She's salty, and this led to increase in toxicity. So because allopurinol competitively binded with xanthine oxidase, now 6-mercaptopurine cannot be metabolized. This will increase its toxicity. If you remember, how do we treat this? We can treat this by reducing the 6-MP dose by 75%. Okay. So the main effects of allopurinol here are that it, of course, its main function, we want it to lower plasma uric acid levels. And also, you can see this sprayer over here. This is for dissolving the toffee or toffee. I don't know what it's pronounced like. Toffee. So it also will prevent the progression of gouty arthritis and the risk of nephropathy. So less gouty arthritis and less nephropathy. And this nephropathy is going to be related to probenecid here. Okay. There are some adverse effects here. So the adverse effects are hepatitis and peripheral neuritis. So why hepatitis? That is basically because xanthine oxidase is mainly expressed in the liver. And if we inhibit this enzyme, it could lead to this adverse effect. Something to note also is that we should not use allopurinol for acute gout attacks. Why is that? Over here. Should not be used for acute gout attack. So that's because in the early stages, so you can say here, this is allopurinol. She's a newbie to her job. This is her first job. So during the early stage of treatment, allopurinol can lead to a gout flare because of tissue mobilization of the urate crystals. So basically, she's new to her job. الurate crystal ما يسمع كلامها. يعني سحب عليها. How can we إيش الحل الحين? So الحل here, so this can be prevented by using colchicine. And we'll see later that she is very chill. ما همها أحد. So she's very chill, and therefore, as the opposite of here frustrated allopurinol, she can be used in the beginning of treatment. And not only colchicine, we can also use NSAIDs like endomethacin, and this is going to be used for all of these hypouricemic drugs. Next, we have probenecid. So what did we say about probenecid? We said that probenecid increases the excretion of the uric acid. See? It increases the excretion. So it's also used orally. They're both together here. So allopurinol was orally. Probenecid is also orally. And as you can see here, she's got 2 buns. So that means it's used twice daily. Okay, it's actually 2 to 3 times. Could be used either 2 or 3 times daily. And because she's a probenecid, this drug is used for long term in order to prevent gout attacks, and also to prevent permanent joint damage. Okay? So, pharmacokinetics, something that makes probenecid special is that it is highly bound to plasma proteins. About 90% bound. And it is metabolized in the liver and excreted in urine. So because excreted in urine, we're going to have some stuff to do with the kidney over here. So probenecid acts, it acts on the proximal tubule. It will act on the proximal tubule and inhibit, let me just erase it, okay. And it will inhibit the urate 1 transporters. So the urate reabsorbing transporters 1. So it will inhibit this. We don't want to reabsorb uric acid. We want to excrete it. And this will lead to, as we said, increased excretion of the uric acid. The adverse effects, now because we said it acts on the kidney, what could you expect? So they're over here. We could expect renal colic, which is urinary tract stones. So not only kidney stones, they could be anywhere in the urinary tract. And as we said for allopurinol, probenecid also should not be used for acute gout attack. And Sadfa is like we said over here. This also applies for probenecid. And if you remember again, we said that all three should be used in combination with colchicine or NSAIDs to prevent gout flare. And if you remember in the lecture, we said NSAIDs, but not aspirin. Okay? Here, look at the shade over here. NSAIDs are welcome, but not aspirin. So something also we remember, okay, I'm going back and forth, I'm sorry. If you remember, sodium bicarbonate helps in increasing excretion of urine in general. And this urine, in this case, will be associated with uric acid. So if we want to increase the excretion of uric acid, we will have to give a dose of sodium bicarbonate. Okay, what are some contraindications? So as we said, contraindications here would be kidney stones, if someone has kidney stones, and also contraindication for acute gout attack. Why? To prevent gout flare. Okay, I think it's so far so good. Wait, one last thing about probenecid, and it is that probenecid here, she's best friends with allopurinol, and so to help increase the availability of allopurinol, we want to increase allopurinol. Probenecid over here enhances the clearance of oxypurinol. Oxypurinol is the active form, so it enhances the clearance. So you could say in this case, Oxypurinol tried to confess to probenecid, but probenecid here rejected the guy because she was only here to support her best friend. So, bros before hoes, man. And yeah, so that leads to the increase in the dose of allopurinol. Okay. Now on to pegloticase. So pegloticase is used as an IV infusion, and I remember her as like a pirate with a peg leg. And pirates on their ships, they sail for like long durations. That's why pegloticase is given IV for a long period of time, which is every 2 weeks for a duration of 6 months. And also, so it's used IV, but it could also be used with oral urate lowering therapy. So this urate lowering therapy is used for persistent arthritic symptoms, toffee, or if we're doing the treatment but we're still unable to achieve desired urate serum levels. And what was the level that we wanted? Less than 6 milligrams per deciliter. If we can't use it, we go and try the oral urate lowering therapy, and this is for pegloticase. And we said from the beginning that it was like allopurinol, as in it is used as a prophylaxis for patients with leukemia and those who are undergoing anti-cancer treatments. And also it can be used for people with acute nephropathy. So both can be used for nephropathy, but probenecid over here cannot. Okay, let's just clear the page. So something that is unique to pegloticase, so we said that these two are uricostat. They're at the door over here. But pegloticase here is mammalian recombinant. So hence the kitty pin. And it has a very long half-life. So as I said, the pirates on the ship, so its half-life here is from 14 days to weeks. And it's significantly longer than its uricase. So just so just saying, okay, pegloticase is basically how do I explain it? So it's a recombinant of uricase, and it's pegylated. But in uricase that's not pegylated, you can see it's significantly lower half-life. So although it has a long half-life, it is rapidly acting and achieves its peak effect in just 2 days. That is peak performance. So the mechanism of action here is that the pegloticase is going to convert uric acid into allantoin. So Allantoin here, I represented it here with tenderloin steak. So this steak is like it melts in your mouth. It's like medium well. And so basically, you can say that allantoin is highly soluble. So we made these crystals into allantoin, which is highly soluble, and now it can be eliminated by kidney. Same thing, as we always said, this. And something different about here is that it could lead to hypersensitivity, pegloticase, anaphylaxis, and that pegloticase should be avoided in patients with G6PD. Why? Why not given to patients with G6PD? Well, that is because pegloticase leads to the formation of hydrogen peroxide. So the uricase, because uricase leads to formation of hydrogen peroxide. That's why we cannot give it to people with G6PD. That's all we have for the hypouricemic drugs. Now we'll go on to the other drugs that are used for acute gout. Our guests over here. So I'll start with endomethacin. We're all pretty familiar already. So we know that it's used, it's anti-inflammatory. It's basically an NSAID. And something about this is, okay, so we said that endomethacin is really good at her job. She likes to do it quickly. So endomethacin here achieves, it's effective if given within 24 hours. 24 hours, because she's a very busy lady. She's not going to do the job if it's later than 24 hours. So we can use any other NSAID, not just endomethacin, but Hamshay, it's not aspirin, because aspirin is contraindicated as it inhibits the excretion transporters for uric acid. And sometimes we can use the steroidal anti-inflammatory agents. We can use them in some cases, like prednisone. We discussed that one before. And it's used if we want to decrease the side effects of NSAIDs. Because NSAIDs, we know that they have side effects, so sometimes we can use these steroidal. And we also have something called this is hard for me to pronounce. Triamcinolone. Triamcinolone is also going to be covered in the anti-rheumatoid arthritis. And triamcinolone is used when only one or two joints are affected. Okay, عشان تضبطونه try. So number 3, واللي قبله 1, 2. خلاص, we have 1, 2, 3. Now on to our last drug, colchicine. So as we've been saying since the beginning, colchicine is used as a prophylactic to prevent acute gout attack. And also it's used in combination with the previous hypouricic the hypouricic drugs, these three, to prevent, not to just prevent gout flare. As we said, she's the chillest in the room. Now, there are some precautions here. So endomethacin is having a talk with colchicine because of her low performance. So first, it is not analgesic, and so it does not treat pain. It doesn't treat pain from other causes in general, but it does treat gout pain indirectly. And here it doesn't decrease hyperuricemia, because we said that these three, the bodyguards here, the security actually, the security, why do I say it? Anyways, so the security here, these are the hypouricic drugs. So here she doesn't decrease hyperuricemia. And lastly, it does not prevent the progressive joint destruction. Which one of these does? We said probenecid. Okay, so these are precautions. So colchicine here, in general, the mechanism of action here is that it inhibits the migration of neutrophils into the site of gout. So it inhibits both activation and degranulation of neutrophils. Why is that? So that it can prevent inflammation and, as a consequence, prevents gout pain. So it only inhibits gout pain. And as you can see, honorary anti-inflammatory. So that's what it does. There is a specific mechanism of action on the slides. You can go back to it over there. And as for the side effects, so it just as paclitaxel, so it basically has the same mechanism of action. So it causes alopecia. She's got gorgeous hair, so she doesn't want anyone to have gorgeous hair like hers. Also, hyperglycemia. As you can see, she's got some candies over here. Hyperglycemia. And lastly, I'm sorry for this image, but chocolate. Oh, this is 25. It's supposed to be 23. Let's just say the chocolate is diarrhea, okay? It's like she's got a sweet tooth. So hyperglycemia. And diarrhea.